Celebration today. I am Becky Tuttle, and it is my privilege and honor to serve on Wichita City Council representing District 2. Thank you for joining us here today at Fire Station 1. Thank you so much for opening your home to us today. We appreciate it. I am honored to be kicking off the official unveiling of a program that many passionate people have come to work together on. I want to begin by recognizing my fellow electeds. If there's any in the room, I didn't see any that could join us today. We're all kind of running around in crazy places, but I want to thank them all for their continued support of this initiative. I want to begin also by saying shortly we'll hear from Chief Snow and also the International Association of Firefighters Union Local 135 Ted Bush, representatives from Via Christi, and then we'll be available to take any questions that you may have. We know that firefighters bravely put their lives on the line for us every day. I often say our Wichita Fire Department runs into the buildings that we are running out of. We may not know the risks they face that extend far beyond the fires that they battle. Studies have shown that cancer is now the leading cause of line of duty deaths among firefighters. Studies from the National Institution of Occupational Safety and Health found that firefighters have a 9% higher risk of being diagnosed with cancer and a 14% higher risk of dying from cancer compared to the general population. I have spoken about this before, that I began my career in public health and working with healthcare providers. I am passionate about improving the health outcomes for our entire community and have done this through many initiatives. And this is doubly true for the individuals who put their lives on the line for us each and every day as firefighters. We began discussions with Via Christi as hypothetical. What would early intervention programs specifically for firefighters look like? How could we manage the process from start to finish to ensure that early testing and prevention is available for cancers and other related health risks for our firefighters face each day? And we created a group that was extremely dedicated professionals who came together and said, yes, yes, we can do this. Yes, this is important. And yes, we believe in serving Wichita's finest and bravest. And this is just the beginning today. We are formally unveiling a program, but the first step and the critical step towards robustly providing early intervention services for our firefighters. Our hope is that we will expand, grow, and provide more comprehensive testing and services for Wichita firefighters. And now it is my pleasure to invite up Wichita Fire Department Chief Tammy Snow and Fire Union President Ted Bush.
Good afternoon. Thank you, Councilmember Tuttle, for your kind introduction, and more importantly, for your relentless work in opening these doors and making this vision a reality. Your passion and dedication to the health and wellness of firefighters has been the driving force behind this initiative, and we are deeply grateful for your unwavering support. Today is a deeply meaningful day for our department and our community. This initiative is not just about addressing the health risk our firefighters face, it's about honoring the sacrifices they make every single day. Our firefighters are there 24/7, standing ready to respond to emergencies in every corner of Wichita. They face intense, unpredictable risks that most people can't imagine, yet they never hesitate. They answer the call with unwavering courage because they believe in something greater than themselves, the safety and well-being of this city. The reality is, the dangers don't stop when the flames are extinguished. Long after the fires are out, the risks linger. Cancer, heart disease, sleep disorders, and the mental strain of this job are challenges firefighters carry with them every day. These risks are real, and we cannot ignore them. This new initiative is a promise, a commitment to stand alongside our firefighters, just as they selflessly serve and protect our community every day. It's a pledge to provide them with the tools, resources, and support they need to not only survive, but thrive. The cornerstone of this program is prevention. With early testing, dedicated navigators, and proactive care, we are taking steps to catch potential health issues before they take root. This is not just about treatment. It's about giving our firefighters the opportunity to live long, healthy lives after their service. This initiative is about more than just health. It's about shifting our culture. For too long, many firefighters have felt the need to bear these burdens alone. Today, we are saying loudly and clearly, you don't have to. We're here for you. We are committed to ensuring you have access to the best care and support available. I want to express my heartfelt gratitude to the incredible partners who have made this possible. To the dedicated team at Via Christi, thank you for your vision and your determination to address this urgent need. To our union leadership, thank you for championing this initiative and advocating for the well-being of your brothers and sisters. To our firefighters' families, thank you for your strength, your sacrifices, and your unwavering support. And most of all, to the firefighters of the Wichita Fire Department. You are the heartbeat of this city. Your bravery, your commitment, your resilience inspire me every day. This program is for you because you deserve it and because we owe it to you. This is just the beginning, but is an important first step towards building a stronger, healthier, and more resilient fire department. Together, we will continue to protect and serve Wichita, not just today, but for generations to come. Finally, I want to express my deepest gratitude to the rest of the team who had a role in bringing this initiative to life. The mayor, the city council, the city manager, the City of Wichita's communications team, the City of Wichita's human resource team, Station Zero, and Wichita Fire Administration for believing in this vision and helping us take this crucial step forward in protecting Wichita's bravest. With that, I'll turn it over to IFF President, Local 135, Ted Bush.
You just saw an example. That's what it's all about. 24/7, every second of the day, no matter what's going on in their lives, that's what they do. That's an example of what they do. And that's why we're here today. Good morning, everyone. Thank you for being here to celebrate this important day. Today marks a turning point in our commitment to health and wellness of the brave men and women of the Wichita Fire Department. Individuals who selflessly serve and protect our community every day. This new and innovative health initiative has been a long time coming. And it is not only a response to the challenges our firefighters face, but a recognition of the extraordinary sacrifices they make for all of us. Firefighters put their lives on the line with every emergency call they answer. Yet the risks they face extend far beyond the immediate dangers of fire and rescue. Recent research has made it painfully clear that firefighters are at a significantly higher risk of developing cancer and other health difficulties, an epidemic that has turned the day-to-day risks of this job into a lifetime of health challenges. This initiative is our promise to do everything we can to combat this growing threat. Through health testing, education, and prevention, our aim is to ensure that our firefighters are equipped with the tools and resources needed to protect their health not only during their careers, but into retirement. A healthy fire department is essential for a healthy community, and we owe it to these heroes to address these risks head on. This program emphasizes not only physical fitness and injury and illness prevention, but also mental health support and a holistic wellness. It ensures that our firefighters are equipped to perform at their very peak for you. The health initiative represents a new standard of care, and we hope it becomes a model not only for Wichita, but for the fire departments across the entire state of Kansas. It's our hope and belief that this investment in firefighter health will lead to better outcomes for everyone in our community, because a healthy fire department is at the heart of a safe and thriving city. This initiative would not have been possible without the vision and the passion and hard work of Councilwoman Becky Tuttle, her unwavering dedication alongside the efforts of the City of Wichita staff, Wichita Fire Administration, and us, Wichita Firefighters Local 135, and finally, and most importantly, our Via Christi family, who have taken this initiative beyond our wildest dreams. I would like to particularly thank Keisha Humphreys. Her leadership and vision have made this possible. Also, I would like to thank Maxie Wiggins for her dedication and tenacity in the development of this program. Also, with our Via Christi family, Colleen Pate and Dr. Brett Grizel. They're all amazing, amazing people. And finally, Marcy Kelly, who saw the need and took action not only for her son, a current firefighter, but for all of his fellow firefighters. Her concern and care for firefighters has been the catalyst for our efforts here today. Also, last but not least, I'd like to thank Brother Dow Gaines and his staff at Station Zero Gym. His insight into firefighter health is just another level of care that's vital to the success of this program. Again, thank you to everyone who's contributed to this effort. Together, we've proven that when people from different backgrounds and professions come together, they can accomplish extraordinary things. Past difficulties and disagreements can be set aside for the common good of people that deserve it. There's strength in that, which brings us together to work toward a shared vision, one that transcends all of us and builds a future far greater than we could achieve alone. This is more than a program. It's a promise to our firefighters, to their families, and to the citizens of Wichita that we are committed to their health, their safety, and their future. Thank you.
Thank you so much, Chief Snow, and also President Bush. Next, I have the opportunity to invite up some of our wonderful and dedicated people from Via Christi, our new friends, who are helping bring this work to fruition. I'd like to invite up Nurse Navigator Keisha Humphreys and Dr. Brett Grizel from Via Christi. Thank you for joining us today.
Hi, thank you so much for having us here. I would like to thank the Wichita Fire Department, the Local 135, Beyond the Call, and all the firefighters who allowed us into your homes. When we started this conversation over a year ago, it was because we had seen too many patients in our home and our hospitals that were firefighters, and we knew there was a problem. So at the time, we started talking, and it found that we had lots of friends who actually were all thinking the same thing, that we should help protect our heroes. So we worked hard for the last year, and amazingly, here we are today. This program, this initiative, is the next evolution of all that we have done. We had a pilot, we found problems, it was a great pilot, and now we're here to open the doors. So we will actually be having a phone number dedicated and a nurse navigator dedicated to the use of our firefighters. So the goal will be that we will help work with them, have year-to-year screenings, and find cancers early. And that way they can walk their daughters down the aisle, they can play with their grandchildren after all they have done for us. We're very, very blessed that they have allowed us into their homes. Early detection drastically increases survival rates, and it helps people live longer and improves their quality of life. Via Christi will provide the firefighters and their families with resources and other information as we go. Our goal is to proactively protect our heroes. Now I'd like to introduce Dr. Brett Grizel, who is the medical director over this program.
Thank you for having me. Thank you for the Wichita Fire Department, Local 135, and Beyond the Call. This is an easy job for me because I'm working with such strong, dedicated people that have such a passion for helping all of us. I also want to thank Ascension Via Christi's administration, the resources that go into putting these kind of programs together, and putting the personnel and the surgeons, pulmonologists, nurse navigators together. I truly believe they've put together a world-class team. That team has worked for 4 or 5 years on similar type projects, and been very successful. The strong possibilities here are you catch disease early. And when you catch disease early, you can take care of it and treat it before it becomes a big problem. So this program is meant to work alongside your primary care physician as a tool and a resource to help guide and put the right programs in place to help catch problems early. Again, we're very appreciative for the work you do for our families, and this is a good marriage between two very passionate programs, Via Christi and the fire department, to help each other. So I'm very honored to be a part of it, and thank you for allowing that.
Thank you to Keisha and to Dr. Grizel for joining us today. And now I have the privilege of being able to invite up one of our very own firefighters, Captain Michael North, so you can hear from him and his journey of how early intervention has impacted him. Welcome. Thank you.
Good afternoon. I'm Mike North. My fire family knows me as Bubba. So I'm going to go through it real quick, where I was, where I am, and where I'm going. I've been on the fire department for 27 years. Been married this May 32 years. I have 3 kids. And in March 31st, I'll be expecting my first grandkid. So you'll see how much this means to me. I had my first scare in 2018. I thought I had a possibility to have colon cancer, and I didn't. It was a history in my family. So from that point on, I started doing regular screenings every year. And then I got to where I started doing them every 6 months. So in October of 23, I had blood work done, and it all came back fine. In February 28th, I got a phone call. Called, I was sitting there with my daughter, we were getting ready to hit the gym, and they said, your blood work's not good, we need you to come to the hospital. And of course me, I was feeling just fine, and we wanted to go to the gym. So we went to the gym, and I got another phone call, and was recommended to an oncologist. To give you an idea, just from that short time frame, my white cell count had tripled from October to February. It was normal in October. I was diagnosed on April 9th of last year on my 55th birthday, and by the time I was diagnosed, my cell count level had went up 10 times the normal level. So fortunately for me, I got in with a good facility, a good doctor. I'm just taking meds. I'm able to take chemo meds to control mine. But after getting that phone call, my wife was with me the whole way. My kids were super supportive, but having to call your parents and tell them there's something wrong, you'll get another phone call from me when it comes around. It was a real hard for them to take. So going through what I'm doing, regular blood work, now I do blood work all the time, along with other testing. But in August, we get another phone call from that same doctor that called me, but this time it was about my wife. So luckily, she doesn't have what I have. She does not have cancer, but she is diagnosed with something else. So twice in 6 months, we got that phone call, all because we did pre-screening. We do regular blood work twice a year. We get regular physicals. So the key to this is preventive. Get ahead of it. So I want to thank everyone for being here and let me come up and tell my story, because right now I'm just ready to see my first grandkid. I'm going to have a granddaughter named Emerson Sue, and I'm pretty excited about it. Hey, thank you very much for your time.
Thank you so much for sharing your story, and that's exactly why we're doing this. This program is designed to streamline early intervention and testing to catch health issues before they become worse. And today I'm excited to have two special announcements. If I could have my friend Ashley just come and stand next to me, I would appreciate it. Chief Snow and President Bush and I reached out to the Kansas Health Foundation over a year ago and said, we have a dream. We have a small group, we have a need, and we are interested in seeing if you could help us with cancer screenings for firefighters. Well, we then had the Via Christi got involved, and so just the program has morphed into just more than cancer screenings, but creating a culture of wellness within our Wichita Fire Department. And I am so excited and proud to announce that the Kansas Health Foundation is allocating $150,000 towards this initiative. We're going to use this money to help develop a sustainable pilot project that we hope will be replicated to help firefighters across the state of Kansas. So thank you so much. And thank you to the Kansas Health Foundation for $150,000 to save lives within our firefighters. We appreciate your support. Thank you. The other announcement I wanted to make, and some of you may have seen this, but 2 weeks ago I had the opportunity to go to Topeka with my colleagues and to provide testimony on House Bill 2024. This bill is designed to allocate $250 each year for firefighters across the state, full-time, part-time, and volunteer, to help supplement the cost of cancer screenings that may not be covered by their health insurance. So we are very hopeful that House Bill 2024 will be successful. We thank House Representative Nick Holheisel for introducing it for us, and we already have a senator who is willing to introduce it on the Senate side. So we're hopeful this legislation will augment the work that we're doing here in Wichita, but truly help firefighters all across our great state. Often, and especially when we're young, we believe that we're invincible. What we see time and time again is there are no symptoms, or maybe small symptoms, that went ignored. We want our firefighters to be empowered to take charge and not ignore their health. We are not ignoring your health. And we want to provide every resource possible to ensure their families, have access to support they need. I cannot thank the dedicated professionals at Via Christi enough for being a part of this initiative and saying, yes, let's do this. And to Chief and President Bush, so much have I learned, and this is in growing a culture of wellness for our firefighters. I'd like to thank our human resources team at the City of Wichita, who are coming alongside to ensure that we have the most robust coverage and supportive services available for all city employees, but especially our firefighters. And thank you to our firefighters. They work hard every day to protect us, and now we want to give them a fighting chance. We value you, you protect us, and now we are protecting you. And now with that, any of us, I think, would be willing to answer any questions that anyone may have. Thank you for attending today. Any questions?
How it's going to go in terms of screenings, how many screenings, and what other type of health services and resources will be provided for firefighters. Would you please share speaking at the sound? One second.
Okay, that was a long question, so I want to make sure I got it all. So, Via Christi, actually, we performed a pilot for the program, and we had a list of tests that are recommended from the National Cancer Institute and different organizations. And we took that forward and we used that in a pilot. So most of the tests were covered for insurance entity. We are looking with our foundation to see if there's a possibility of raising funds as we need to continue this program going forward. The yearly screening, it's just that, it's going to be yearly for these individuals, and a nurse navigator will be working alongside them. We have a phone number set up. It's 316-719-FIRE for anyone to call to go ahead and start getting these appointments made so we can get their screenings started. Did I cover everything?
So just understand, Via Christi is working with insurance companies in order to provide these screenings for the patients that are coming in.
So Via Christi will work with the firefighter to ensure that our biggest thing is we want to make sure that we're not being a detriment. You know, one of the worst things about cancer or cancer screening is a financial toxicity. So we want to make sure that we're not having that problem for these individuals. They already have enough issues. They do not need that. So we're going to work alongside them to find the funding as we need and to walk them through the process. Thank you.
That's
All right, thank you guys.
Thank you, everyone.